Voso from the Tor Vergata University in Rome. And Dr. Voso is presenting results from the Harmony Alliance study in APL. I'm a co-author on this abstract, but I have to clearly declare that I have no conflict of interest with that because the Harmony Alliance is composed of many, many contributors. Maria Teresa.
Sorry. Can I have my...
Just go ahead, yeah.
Okay. So, good morning. Okay. So, these are my disclosures. So, acute promyelocytic leukemia is a rare subtype of acute myeloid leukemia, accounting for about 5 to 10% of all AMLs and 13% of those with a genetic aberration. And we may count that about 450 new cases are diagnosed every year in Europe. The prognosis of APL has been changing in the last 40 years, similar to many AML subtypes, and this has been largely due to the use of targeted treatment. First, all transretinoic acid, targeting one of the moieties peculiar for APL, which is the retinoic acid receptor alpha. And the second drug has been arsenic trioxide, which targets PML, which is the other moiety, and this is the rearrangement of PML RA alpha is due to the 15-17 translocation. And as you see here, prognosis of APL has been improving, and I would like to show you the results of a European, Italian, German trial which was first published in 2013, which compared the outcome of patients with APL, standard risk, treated with the ATRA-ATO combination as compared to ATRA chemo. At a long-term follow-up of 72 months, overall survival was with ATRA-ATO's 98.3%. But this is a rare subtype of AML, as mentioned, so we wanted, in the Harmony context, which is a large cooperative study funded by EU on hematologic malignancies, we wanted to look at real life and clinical trial data deriving from large number of patients. And so we took advantage of 6 participating groups, data coming from 6 participating groups, the NCRI from UK, OVON from the Netherlands, the AML study group from Germany, the Swedish cooperative group, and the Student Alliance LEUKEMIA group from Germany, and from the Italian Fondazione Gimema study group. The Harmony platform collects data from all blood cancers, and these data from different data providers, both university and real life and industry trials, integrates all the variables into a common data lake. The data is processed and then can be analyzed statistically. So I will present today the results of 937 patients with APL out of the 1,500 patients who are now up to date in the database at a median follow-up of almost 6 years. The median age of these patients was 50, and this is in agreement with a lower age diagnosis of APL, a good balance between male and females. 38% of the patient had a low SANS risk score defined by a higher number of platelets over 40,000 and leukocyte counts below 10,000. Intermediate risk group was 42%, and high risk group defined as over 40,000 white blood cells was 18%, as expected. The treatment was well balanced, with 40% of the patients treated with the chemo-free ATA-ATO treatment and 54% with ATRA chemotherapy. And as you see here, we had a good proportion of patients treated in the context of of a clinical trial, 57%, and 43% were treated in the real life. Early death in this type of leukemia is a big problem, and we have recorded here 6% of early death, but with a very high complete remission rate of 87% and a relapse rate of only 9%. As you see on the curves, the survival was very good and was significantly associated with age, over 50 and in particular over 70 years old, and it was inferior for patients with a high SANS risk score. As of the treatment, we were able to confirm that the chemo-free combination was associated with significantly longer survival and with a significantly lower relapse rate. So the conclusion of our study is deriving from 50% from real life, confirmed that elderly age and high SANS risk score are significantly associated with the rate of early deaths and irrespective of treatment. Elderly age and high SANS risk score also correlate with reduced survival and event-free survival, but not with the cumulative incidence of relapse. And this is due to the fact that the biology of the disease, it's not different in elderly patients and in higher SANS risk score. The chemo-free combination ATRA-ATO confirms the overall advantage over chemotherapy for all patient outcomes, including also the cumulative incidence of relapse. And the multivariable analysis confirmed that older age and high SANS risk score, and also the treatment type, and also the treatment scenario, real life versus clinical trial, are significantly associated with reduced overall survival and event-free survival. These data need also further. We need higher numbers, higher high-risk patient numbers to confirm the data in this patient subset who are still underrepresented. And I thank you for your attention.
Thank you very much, Maria Teresa. Questions coming from the audience? So maybe I start. Maria Teresa, based on the data showing that the chemo-free combination ATRA-ATO is of benefit, significant benefit in all patients, does this mean it changed the treatment paradigm in APL in the future?
Yes, I think so. Since ATRA-ATO is in label for standard risk APL, including low and intermediate risk, I think we have abandoned the chemotherapy in this patient subset. We have already some data in high-risk patients with high white blood cell counts who have also a high rate of early deaths and differentiation syndromes and other complications, that the chemo-free combination works there. We have the Apollo trial, the pan-European Apollo trial in high-risk patients, and this has closed 1 year ago, and we will have data from that. In that case, we need some chemotherapy immediately, at the time of treatment start because of the high white blood cell counts. But I think, we are getting to the point where the chemo-free treatment will substitute chemotherapy in all APLs. And we also have oral arsenic trioxide as a possibility for the future.
That sounds very promising. And you have more data from the Harmony, and maybe you plan to do a follow-up study?
Yes, so we have more data in the platform, and we hope to involve also centers outside Europe, Australia or US centers, to have a larger database and look also at other variables. For example, differentiation syndrome, how to predict it, how to better treat it, and also other complications, extramedullary localization, role of maintenance treatment, which has been used in chemotherapy approaches, and it's not there for Atra-Ato regimen. So there are some questions, some open questions still.
There's a question over there.
Good morning, Irma Daria from Italy, La Repubblica. I would like to know how much are the patients are suffering from this form of leukemia, and what about the age? Your data showed that more early you start the therapy, the best is, and I well understand the correlation.
The number of patients is a very rare subtypes of APL. So we expect to see about 30 to 6 cases in Italy, for example, every year, and 450 in Europe. So it's a rare disease. And the median age at diagnosis is significantly lower than what we usually see for AML, is between 45 and 50 years, and this patient group at a median age of 50 years. But for all patients, it is essential that a prompt diagnosis is made, and this is a molecular diagnosis using the diagnosing by PCR, the PML-RAR rearrangement, because one of the most critical factors for survival and for prognosis is that treatment is immediately started to avoid early deaths, usually due to bleeding complications.
Thank you, Maria Teresa.